Greetings all. Yet another remarkable case conference this week with regard to Ariel. There are several themes that I want to highlight, and also I want to let you know how much I appreciate the depth of insight and experience that you brought to the conversation. In terms of definitions, Ryan points out with regard to harm reduction, this approach can often show clients that we aren't here to change who they are. We just want to help them become the person they want to be. That's a wonderful framing of harm reduction and the purpose of it. Let's think about assessment for a moment. First, with regard to Ariel, and then with regard to her mom. With regard to Ariel, as Jose points out, it's critically important to get her perspective. As Jose says, I want to know her perspective rather than what's on the paperwork given to me, because I don't want to come in with any preconceived notions of her. This is, in general, so important. Your clients will often come to you with extensive case records, and it's important to find a way to leave all that information at the door when you actually come to meeting with your client, and allow your client to inform you about who they are and what their goals are, what their needs are. As Jenny points out, addictions come from somewhere, and figuring out where or what might have started them could be the start to a healthier recovery. And this is generally true, that addictions, and for that matter, any human behavior makes sense in ecosystemic context. And as Jenny points out, in this case, in historical context. And it's very important for us to understand where symptoms come from in assisting clients to in their recovery. As Lisa points out, Ariel was clearly able to accomplish a lot academically while she was using things that many sober individuals may find difficult. And that's a major strength that may help her find purpose, accomplishment, and confidence in working on providing for her daughter. That focus on strengths is as always, critically important. As Ryan and Lisa point out, it's quite possible there will be co-occurring issues uncovered that require the formulation of an integrated care team to address the complexity of recovery. This case is a wonderful example of a very complex situation that may involve collaboration of a team of helping professionals, and that coordination and collaboration is critical to the positive outcomes. With regard to assessment of grandma, one thing I want to call your attention to is that nobody talked about making a careful assessment of grandma. Instead, you made assumptions about who grandma is, and in the absence of data, in the absence of information, that's what we will tend to do, is fill in the gaps with our imagination and make assumptions. Several of you acknowledged Grandma's fear about withdrawing support, and fear that Ariel's bottom may become lethal. It's important here to know what the historical context of Grandma's fear is, and what her history is with addiction, with trauma, etc. In terms of intervention, with Ariel, Tricia and Myra and Roanne and Joanne all pointed to the need for a thorough medical workup, and also to consider the possibility of postpartum depression. Joanne suggests evaluating Ariel for a personality disorder, explaining, I would explore why she is described as, quote, an intellectual bully, because it seems like she is a bully toward her mother, partner, and others. I would explore how this would affect her parenting skills also. When there are characteristics such as this described in a case scenario, it's important to rule out personality disorders, because if personality disorders are a factor, then that will affect treatment, certainly. You had an interesting exchange about how to discuss with Ariel her drug use, and how it's affecting her life and the people in her life. And as you pointed out, it's important to avoid engaging her denial and resistance. And it's also important in the context of that conversation as the helping professional to avoid communicating judgment, because she certainly will pick up on it and be reactive to it. Several of you discussed medical assisted intervention, and as Myra points out, Narcan is a very important tool here. That it should be present in the house, that her friends should be educated. As Myra and Anthony point out, it can reduce cravings for other drugs and be used as a mood stabilizer to combat depressive symptoms. And although it's off-label, it seems to be effective at stabilizing people diagnosed with schizophrenia. As Dalen and Anthony point out, there are safety factors also to medical assisted intervention, for example, eliminating IV use and the associated problems, and reducing the legal behavior, and therefore reducing the harm caused to others, and also reducing the problems with stigma and self-esteem related to engaging in illegal behavior. You described working with someone who, when meeting clients for individual sessions, gives them the larger chair at the desk, so the client feels like he's the one in charge of the treatment. That can be very important symbolism. And with regard to motivation, Dalen points out a sense of purpose and recovery. You don't have to subscribe to a higher power or have it, but most people that do recover attribute their life transformation to finding purpose and meaning. which filled the void that drugs once filled. And that's a very important insight. Several of you discussed the importance of joining with the client and strategies for doing that. As Tricia points out, when someone feels safe and connected, the truth starts to emerge so that healing can begin. And we know that that's true of education and healing in all kinds of contexts at any point in the life course, that learning is predicated on a sense of safety. Tricia suggests using motivational enhancement therapy as a helpful start in identifying what motivates Ariel. As Anthony points out, one of the counselors I work with says that anytime we use medical-assisted treatment, there needs to be a behavioral component attached. Otherwise, the person's not motivated to change the deeper issues around the addiction. And this is a very important point. Dalen points out that medical-assisted treatment can reduce cravings for other drugs. And Brian points out, since she is currently unemployed and has a mother capable of watching her child if need be, I would recommend long-term residential treatment, which could prove beneficial not only because of the immersive experience, but also the access to other resources such as group therapy and vocational services. Several of you concurred that the biggest challenge with Ariel is getting her to become engaged in her own recovery and well-being. And Sayana and Tricia point to the very important issue of building the relationship and maintaining the connection while, as you said, her readiness for change slowly emerges. And as you also point out, it's important to remember that pharmaceuticals do nothing to address the psychological, social, and behavioral problems associated with addiction and cannot be relied on to solely facilitate recovery. There was general consensus in this regard. Tricia points out that support is such an enormous factor when recovery is part of the equation. In this regard, Lisa suggests finding a drug-free peer group, a women's therapy group, Myra points out the risk that when she leaves jail, she may well return to using, even if she doesn't want to. And having time of not using increases her risk of overdose because of the lowered tolerance level. And this is, of course, very important information for social workers. It's noteworthy that everyone succeeded in suspending judgment when discussing Ariel and focused on facts of the case and positive avenues for change. And this is remarkable, particularly in such a complex case. With regard to grandma, you made several important points. You discussed the barriers to intervention related to HIPAA. And Angie points out in her own county the policy of addressing grandma only after the parental rights are terminated. And of course, there are many problems with this sequence of interventions. As Michelle points out, parenting grandparents often fall through the case management cracks. And Jennifer underscores the importance of support for grandma and education. And Myra also concurs that psychoeducation about addiction in families is very important. Sherry suggests that a worker coach grandmother to apply for custody, and points out that if Ariel's child is not safe in grandmother's care, then that would lessen the opportunity for grandma to be a designated caregiver in the future, and that's, of course, important information for grandma. Several of you discussed the option of family therapy. One talks about the importance of understanding family dynamics and engaging supports. And this is, of course, essential because we are socially constructed beings, and our behaviors are never absent the social context. However, a family therapy approach might be more effective if both Ariel and Grandma had their own individual treatment plans at the same time. Angie again points to the problem of CWS not involving grandparents and other supports in a case plan. And that's an area in which you will find yourselves having to advocate, because once again, the social context is critically important. Yet another beautifully presented case, and very textured and thoughtful case conference. I look forward to this coming week.